Thanks,
So-
Ange.
Sure, I have some questions here that were emailed to you, Noreen. One of them is, when clients apply for Medicaid and they receive a letter, you do not qualify for Medicaid. What does this mean? This means either they're not age, blind, or disabled, or perhaps they haven't met the 5-year ban. That's usually what that means, if they're not eligible for Medicaid. One of those. They have to be age, blind, or disabled, or meet the 5-year. Okay. Once they meet the 5-year, they can come back and apply. The other question that was on here that I can answer would be, let's see. How soon can a person apply for Medicare? I would say you can apply as soon as 60 days before you're going to be eligible for Medicare. And the reason I say 60 days is because we're working when we work in those cases and eligibility, we're working 2 months ahead. Working at the current month and the next month, and then sometimes we're working the next month and the 3rd month ahead. For Medicare applications, when you apply, for anybody that applies for Medicare and they're eligible, the 1st month always gets denied. And then the Medicare starts the 1st of the following. So if a person applies in the month of April, this month they were eligible for Medicare, we'll get the application that they today, they will be denied the 1st month and then start getting the Medicare program the 1st of, where are we at, June? Okay, they applied today, May 2nd, right? They applied today and they're eligible for Medicare starting in May. They're going to get denied with us, but then the 1st of June is when they're going to start. Let's say they applied last month in April and the Medicare begins today. We're going to deny last month and they're going to start with us today, the 1st of May. So always the first of the 2nd month is when it's going to begin. So I would say 60 days before they start Medicare, it's a good time for them to apply. If we get one like 90 days, we're going to deny it because we're not in that 2nd or 3rd month ahead.
That's great to learn. Thank you.
Let's see, another question on here. Community property. When one spouse is eligible for Medicare and the other one is not. The good thing about Medicare is that we no longer have resource limits. We used to have resources, now it's gone. So that's great. For Medicaid, there is resource limits. For Medicare, no longer resources. We do have to look at the spouse earnings. Maybe they're employed because they're not age disabled. We do have to, and that will, there's an income limit. So we do have to look at the income of both spouses for the person that wants to apply for Medicare, the Medicare Savings Program. There are times, this is on Medicaid, and there's some letters that I gave you, Noreen, when the spend down is 0. It just happens that their income is right in between the 2 income limits. Well, they're going to get a spend down, but 0. Now, sometimes it's the financial worker on my end will send the letter 0 spend down, but will not approve the Medicaid. So it will require, and I'm sorry to say this, but it does happen, is if they see a letter 0 spend down, and if we have not done our part to activate it, it'll just sit there and spend down and M status. So we have to go back. So it would take for the client, they call us or come into the office, say, I got this letter spend down is 0 if I haven't gotten any Medicaid. Oh, okay, we know what happened. We have to go in the case and just approve the Medicaid. Okay.
So Angie, if they get a letter saying that they have 0 spend down, but they don't get a subsequent letter saying that they are eligible for categorically needy Medicare, meaning that they've met their spend down, then they should contact DSHS and ask for that
That's
be
correct.
changed?
Yes,
Okay,
yes.
all right.
Let me see if I any more questions that there was a question here on. How does it work on people on Apple Health who become eligible for Medicare? So once they're eligible for Medicare, they're no longer eligible for Apple Health because now they have a primary insurance and their primary insurance is Medicare. So Apple Health will get an alert saying John Doe is going to start getting Medicare June 1st. They're going to get a termination of that medical from Apple Health. Here's another scenario. The client 65 years old, does not qualify for premium for the free Part A, and they have to enroll in Medicare. They're doing the Part A, conditional enrollment SSA. What is the best time to apply for Medicaid? Again, 60 days, I would say they can apply within 60 days for Medicaid or Medicare. I think that 60 days will cover both Medicare and Medicaid. That's a safe answer for me to say to you.
So Angie, they can actually apply for the Medicaid services before they do their conditional Part A application. Like if someone has a conditional Part A appointment in July or June, I mean, they could do their application now for the MSP that would help for the QMB that would pay that Part A? Or do they need to wait until the conditional Part A application is processed by Social Security?
Yes, until it's processed, yes.
Okay, so they need to apply for the MSP or Medicaid once they have that conditional Part A application processed and the uninsured application and the uninsured Medicare application done with Social Security.
That's correct, yes.
Okay.
I'm sorry, a little confusion here. I thought one of your slides said if beneficiary is eligible for Part A but doesn't have it, they can still apply for MSP. Was that not correct?
Is that for Deena?
I guess, because what I heard you saying though was that you have to have that application already in for Part A. And on Deena's presentation, it seemed to say the opposite. I'm just trying to understand.
So they still need to apply for Medicare. Yes. So DSHS can't open up or screen a Medicare savings program if the client has never gone into Social Security and applied.
But Part A specifically.
It doesn't necessarily. So we always suggest clients just apply for Part B. Because, you know, especially if they don't have we know that they aren't going to have the premium free Part A. Most of the clients that we talk to are ones that have met their 5-year bar. So we'll say just apply for Part B, do that uninsured application, because then at that point, if they get a QMB, we can go back in and then purchase the Part A.
Okay, so to say that back to you, Part A is not required as long as you're eligible in order to apply
Correct.
for MSP.
Right.
Excellent. Thank you.
Yeah, they just have to have some. They have had to have tried. Like we have clients who have never even talked to Social Security whatsoever, and they try to apply for a Medicare savings program. It's not going to work because you have to have something. We need to have either a start date or something in Social Security records in order for them to process that QMB.
Got it. Thank you.
So I have
They just have to be entitled to Part A.
Okay.
That's the key word, entitled.
But so they have to be like eligible for it, but they don't have to have Part A necessarily. They can have
Correct.
Part B only and get the SLIMB or QI1 to pay that Part B. Is that correct?
Yep.
Okay, good. Does everyone understand what I just said? Okay, good. Andy, do you need to go?
I'll wait a little longer. Any more questions on eligibility?
Arlene has a question in the chat. Can you apply for uninsured Medicare at any time, or will Social Security restrict someone to an enrollment period?
Sorry, I jumped in and answered it at time. I do have, I
Okay.
think, that on one of my slides.
Yeah,
So
sorry.
if a client's on Medicaid, they do not have to wait for that open enrollment. They're considered a special enrollment period at that time. We send letters to the clients telling them to apply. And if they take the copy of that letter, that often helps because then they won't get denied for that general enrollment.
Scott, go ahead.
Yeah, I'm a little confused. If I have a client who I believe is going to be eligible, is starting their Medicare is starting June 1st, okay? And I believe they're eligible for a Medicare savings program. We've been instructed to maybe wait until 2 weeks, May 15th, 2 weeks before they go on to Medicare for them to apply for the MSP, because if it's submitted any earlier than that, you won't have records that they're going on to Medicare and it will be automatically denied. So can you set the record straight for me?
Of course, yes, Scott. We have access to Social Security that tells us when they're going to be eligible for Medicare. And if I go into the Social Security system, it will probably tell me eligible for Medicare. Well, I know that the disability was 2 years ago. And I know that most likely they're going to get Medicare 2 years after they became disabled. If they're, let's say they're like 60 years old. So I already pretty much know the date, but I will confirm it in Social Security. They'll say Medicare eligible June 16th. And so if I have an application today, I'm going to process it. There's no resource limit, right? It's just going to be based on income. The income's not going to change between now and June. We're going to process it. We're going to deny May because it's the application month, and the benefits will begin June. And sometimes we'll even see some applications, if we're already working in the month of July, right now we're not working in the month of July. Towards the end of May, we will be working at the end of July. But that's why I say 30 to 60 days, we will accept an application if it says they're Medicare eligible and there's a date they're going to be eligible for Medicare. And they'll get a letter, something saying you're going to be eligible for Medicare June 1st. They'll get the letter from Social Security that they're eligible for Medicare. Another thing that we'll see is that the Apple Health is going to be closing. We'll see the Apple Health closing at the end of May because they're no longer eligible for Apple Health, because now they're going to be eligible for Medicare. So we have two ways of knowing that, from Apple Health and from Social Security.
But it could be the situation that somebody hasn't been on Apple Health, but they may now realize they qualify for an MSP. They weren't SSDI, so it'd be their first time coming into the system. When should they apply for MSP?
I would say the moment they know they're going to be eligible and they have that letter, you're eligible for Medicare on this date, apply.
Who will they get a letter from saying they're eligible for Medicare at age 65?
Noreen, wouldn't it be Medicare?
People who aren't collecting Social Security benefits don't get notification. They just have to apply for Medicare.
Okay.
So I think the answer, Scott, would be as soon if someone's turning 65 and they're not auto-enrolled, if they're auto-enrolled, they're going to be able to see it, right, Angie? If
Yes.
someone's auto-enrolled in Medicare because they're already collecting Social Security benefits, even if they're not on Medicaid, they would be able to see that because they would have it, they would have their auto-enrollment, right? And they'd have their card saying you're starting in 3 months. But for someone who has to apply, they could probably do it shortly after they apply because they have to have that application for Medicare in the first place before they can see that they're becoming eligible for it, right?
The other thing, Scott and Noreen, they will get a letter. You're not eligible, you're denied because you're not on Medicare.
Yeah.
Exactly.
Okay.
So that
Yeah.
means that they're going to have to apply for Medicare.
Right.
That's another cue. Yeah, that's a cue. You're going to get a letter not eligible for Medicare.
But what you're telling us is as long as they're about 2 weeks out, it's okay to
Oh,
apply for that
yes.
MSP or Medicaid.
Like I said, 2 weeks, 30 days, as long as they've been approved for Medicare, we will process the application.
Okay, awesome. Because that is definitely a change, right? We've been told 30 days to 2 weeks to wait, to wait until that last month. So Angie, I have a question. So if we are helping a client, is there a cutoff in the month where their application is going to be, or their eligibility is going to be delayed to the following month, like the 20th of the month or something, when it's going to change over to July, so that we know if we have to have a sense of urgency on something? Even a general rule
It
of
just
thumb.
depends on the month, but I said like 3 or 4 days, the last 3 or 4 days of the month, we're already in the 3rd month ahead.
Okay. So we could pretty safely say if we've hit the 20th, that clients should expect that it's going to be 2 months before they get there.
Yes, but if they don't hear from us, they applied and they don't hear from us, they have to get a denial approval or something.
Okay.
And if they don't get anything, have them please call the contact center 8 to 2 or come to their local office between 8 and 2.
Okay. And right now, what is the fastest way to submit an application for MSP or Medicaid and have it get approved?
Well, if you're computer savvy online,
Okay.
if you want to see somebody, and I know a lot of folks want to see somebody, I suggest for them, if they want to visit an office, the cutoff is 2 o'clock every day. I would say go out 1:30, because they're only gonna have to wait like maybe a half hour, 40 minutes, and then as long as they're in there before 2. Some people come at 8 o'clock, but they're really busy, they could be waiting 2 hours. So I'd rather they come in like at 1:30, 1:45, get checked in before 2, they'll be seeing that then get processed.
Okay. That's all the questions that I have received from people or had myself. Does anyone else have anything for Angie?
And I'm gonna put down my name and number and my phone number.
Yeah.
And I also will give you my email. Please feel free to give me a call. And I will take care of you. I know I've been speaking to a lady, I can't remember her name, I'm sorry if you're here. I sent her some envelopes, prepaid envelopes.
Peggy, was that you? I know someone got prepaid envelopes for sending applications in.
Yep, so I will.
Oh, I'm sorry. Yes, I did get envelopes. Thank you very much, Angie.
You're welcome. Yep. So let me know and I'll do the same thing for you. There's my phone number, it's my cell phone for work and my email at work. If you have any questions, please feel free to send them to me, okay?
Great. Thank you so much, Angie.
You're welcome. Thank you so much. We'll talk to you soon. Bye.
Bye. Okay, Deena. Monica, did you have a question before we get started with Deena?
I do, and it might be Deena that may be able to assist us. Sometimes we get clients that have a Part B debt, and they stopped their Part B and then restarted their Part B, but they have a debt that's owed, and then they qualify for MSP. Is that something that the buy-in can help assist with paying that Part B debt?
Hang on here, I'm doing 2 things at once. It's not sharing the right screen. So when it's kind of complicated because when they go on to the buy-in, some of that debt is kind of like absorbed into the buy-in. But I say some, not all. And when they go off, I don't know.
Sometimes I don't know if it matters, like,
yeah,
I don't know if it matters like the time frame, if it's been like a year or 6 months or whatnot, but with the best thing to have our volunteers send the referral to the buy-in unit for the client to contact the buy-in unit to see if they can get assistance for that. Okay. All right. So that was
Normally when they go on to the buy-in, it kind of resolves. It's just when they go off that I'm not sure if then they would then have to go back, and it kind of depends too. If there's a Social Security sometimes will still take, if there's an overpayment, they'll still take it from their check. But if it's like they enrolled late and they got a fee, then normally that's just absorbed into the buy-in file. It kind of goes into their, it kind of dissolves. But again, I'm not for sure if they go off, what happens.
Okay. All right,
Yeah.
perfect. And so I have another question too. Another one is a look back on Part B premiums. If someone has been on Medicare for quite some time, and then realize that they qualify for an MSP, how far back will you go back to pay their Part B premiums? And
So we
who
can
pays, who reimburses it, and who do we tell them to contact to make sure that they get their money?
So if they have a QMB or a something open, and we never paid the premiums, we can go back. The general rule is they just changed it. We can go back 36 months.
Okay.
Generally though, we only normally go back about 2 years. But if a client is calling and like it was really our error, we should have been paying them the whole time, then there's ways around it that we can go back further. But again, if there's questions on that, like if they're having money taken out of their check, we never paid the premiums. Let's say they were on QMB for like 3 years, and I'm still having money taken out of my check. What's going on? It could be that we just, oops, for some reason the buy-in just never happened. We'll go in and make it right.
Okay. All right. Perfect. So really just sending the referral, having the client contact, and it's okay for beneficiaries to call you, right?
Yeah. Oh yeah.
Perfect. Okay.
Yeah.
All right.
Yeah.
Thank you
Have
so
them call
much.
the buy-in unit directly. If you want to call with them on the phone, if they don't understand and you're with them and you want to walk them through, that's fine too. Either way.
Yeah, your team has helped us quite a bit. I'm Monica with Aging and Long-Term Care of Eastern Washington, and your team is amazing.
Oh,
We've
good.
gotten a lot of help from you guys.
Good. Okay, I'm going to try to share this again. Make sure it works. Okay, come on. There we go. Go down to the questions. Okay, so the first question I got was that the consumer is on Medicaid and transitioning to Medicare. Do we advise to wait until the 30-day prior to apply for MSP? Is this possibly done automatically for someone on Medicaid or ACA Medicaid without the consumer having to make an application? So when a client is on the classic Medicaid, not the Apple Health, but when a client's on the classic Medicaid, they don't actually have to do a separate application for a Medicare Savings Program. Our staff will go in and see that, oh, this client is on, let's say they're on a categorically needy program and they don't have MSP. We send a process over to DSHS to have them automatically go in and see if they qualify for that Medicare Savings Program. However, the client cannot apply for a Medicare Savings Program without having some kind of Medicare entitlement first. So we oftentimes will see there's been an error. A client got put on a Medicare Savings Program and they don't have Medicaid or they don't have Medicare yet. And it ends up creating a big problem because they can't get their prescriptions. They get access to care issues. It creates a mess, and our staff have to then go in and fix it, and then we've got to contact our provider one team and have them fix it. And so it's like, don't apply for MSP until you have that Medicare entitlement, because we don't want to mess up their prescriptions or access to care. Question number 2 was, in the case of someone who has not applied for Part B or Medicare but appears to be eligible for Medicare Savings Program, would that cover the Part B premium? What is the order of application? Apply for Medicare in or outside of the general enrollment first, or apply for Medicare savings programs or stimulus applications? So again, the clients must apply for Medicare prior to applying for a Medicare savings program. However, if a client declines their Part B and they have free Part A from Social Security when they apply, then the buy-in unit will then go in and pick up the Part B premiums and Part A too. If they can refuse both. They're entitled to Medicare A and B. They decide they want to refuse both, then we'll go in and pick up the premiums for those. The
A quick
Medicaid,
I'm sorry, quick follow-up
Sure.
on that. I've had a couple of clients that have appear to, you screen them, they appear to be eligible for MSP, but they claim they cannot afford to pay the Part B premium
Right.
in the interim.
Uh-huh.
Is that one where you could tell them, sign up for Part B, but then don't pay it?
so I would have them apply for it, and then they can refuse it.
And can they refuse it if they're getting Social Security, or will they automatically take that Part B out of their check?
So if they're getting SSI, ideally they're not supposed to be taking it out of their check.
Okay.
I say supposed to be because we've had times where they have taken it out, but with social SSI clients, actually, they're handled a little bit differently because those the payments automatically pulled from us. We can't stop the payments for those. So Social Security is supposed to go in, pull the premium payment for those clients automatically, but there have been times where they've gone and taken it from the client too. But again, Social Security has told me that is supposed to never happen. So I don't want to say yes, always that will never happen, but again, I don't have control over what Social Security does. But
Right.
yeah, well, go ahead.
So Deena, what we have oftentimes is people who come in with Medicare and they've only gotten Part A because they can't afford the Part B
Right.
premiums, not realizing that they're eligible for any assistance.
Mm-hmm.
So they'll have Part A only. And I think one of the questions here is, should that person apply for Part B first? So in other words, if they've either signed up for Part A only, or they were auto enrolled and they declined Part B because they felt they couldn't afford it.
Okay.
So the buy-in unit, they can do a buy-in on Part B and initiate Part B, can't they?
Yes,
It's
yes,
only Part
yes.
A that they can't. Okay. So
Right.
so the person, you can do an MSP application for a person with only Part A,
Yes.
and then and they will initiate the buy-in for Part B, and that will start the Part B, correct?
Yes. The
Okay.
client doesn't have to then go back and apply for Part B again. No, as long as they're, if they get a Medicare Savings Program application in, they're approved, we just automatically go in and pick that up.
Okay. Does everyone understand that? And Lou, is that what you're kind of asking?
That's exactly what I'm asking. That's really useful
Yeah.
information. Thank you.
Okay.
I want to clarify some of the language that's being used.
Sure.
As an ex-21-year Social Security employee, if somebody wants to withdraw from Part A, that means their Social Security check will be turned off and they have to pay everything back.
Right.
You can disenroll from Part B, keep your check, but if you want your premium-free Medicare Part A terminated, you terminate your Social Security benefits, period.
Right.
Thank you. Yeah.
Sorry, I was referring to the not free Part A. So thank you for clarifying.
Yeah.
Can I clarify on this example? So you mentioned that if the person is on Medicaid, they can apply for Medicare outside of the general enrollment period or special enrollment period. But what we get folks sometimes who have just missed the boat completely, past 65, never applied for Medicare, not on Medicaid. How does somebody like that, but their income is low enough they're eligible for MSP? How does somebody like that, what is the order of applying for Medicare and MSP in that situation? Do they have to wait for general enrollment period?
So I'm strictly Medicaid, so I can't really technically answer outside of Medicaid. But I mean, my suggestion, and this is just coming from me, is that they could apply for Medicaid, not for a Medicare Savings Program, but they could go in and apply for Medicaid if you feel like they would fit, the income requirements. Apply for a Medicaid, and then once they get onto Medicaid, we're going to send them that letter that says, hey, you need to apply for Medicare. And then at that point, they could take that letter into Social Security and say, oh, I need to apply for Medicare. Because then that way they wouldn't have to wait for the open enrollment. But otherwise, if they're not Medicaid, I believe they do have to wait for that general enrollment period.
Wouldn't Medicaid require a resource limit test as well, though? In other words, they might qualify for MSP, but not qualify for what you're calling Medicaid.
Right.
Right. Go ahead.
I actually had a case like this, and the way it ended up working is because the person was over 65 and they were income eligible for MSP, not Medicaid. But they had no Medicare, right? So they went in and applied for Medicare and they got their Part A, and they were over 65, so they were eligible for it, and it went retroactive for 6 months, right? Then they applied for they had their Medicare number. So then they went and applied for the MSP and got that Part B buy-in for their Part B, and that started the Part B.
Yeah.
So that's your answer when they have nothing. Or if they have the Part A, they can apply for the MSP and get that buy-in for the Part B, and that starts the Part B, just like we were talking about.
And Social Security does contact me quite often. They'll say, hey, we have a client that's applying. You know, do you show that they would be eligible or have anything on the Medicaid side? So they do contact us too, and keep that contact going, and you know, we'll answer like, yes, it looks like they've tried to apply, but you know, they don't have Medicare yet, so we can't give it to them, or you know, so we do have that contact between the two.
Okay, thank you. I think we have more questions, right? Yep.
One more here. Social Security benefits who have no work history and would have to pay Part A and Part B. What happens to their Medicare application? And are there any circumstances in which they would be better off on Medicaid without Medicare? So again, this is Social Security clients, again, automatically come over onto our system and we pay the premiums. Social Security takes the premium payment. When so again, Washington, we call it an auto accrete state. So Social Security will automatically send that payment, it gets paid, and we can't stop this. There's nothing we can do. We can even close down the medical program and it will still continue to come. They'll still continue to pull the money. There's no way around it. You know, we get clients again who are like, I don't want you to pay this. And I'm like, we're stuck. And even if they move out of the state and they never contact Social Security to change their address, we still are stuck paying that premium. So first answer is, we're paying it. And the second is no, they cannot have just Medicaid without Medicare. And again, there is actually a whack out there that because Medicaid is the payer of last resort, if they're eligible for Medicare, they have to keep their Medicare in order to keep their Medicaid. So I'm hoping that answers that question. But yeah, there's no way for us to even stop it.
Great. Did you have any more questions from email, Deena?
Oh, looks like there's I think this was the same question. When someone is eligible for Medicare and also Medicaid, do they need to apply for Medicare first before applying, or? Oh, this was actually one of my DSHS questions. That's not supposed to be in there.
All right.
I use the same slide, so.
Yeah. No, it was great, actually.
So, I don't know.
Feel free to leave those on there for the set that we do, because we always like little other things, right?
Okay.
Or sometimes maybe being worded a little differently helps someone understand the answer. We have one more question in the chat. How is it that CMS can initiate the buy-in without an application that shows all income sources? You had said that CMS can initiate some buy-ins.
So those are for the SSI clients. So SSI clients automatically get bought in. We can't stop those. So those, and actually it automatically, their Medicaid, their SSI Medicaid automatically opens into our system also. I have no idea how that's done. It's like magic. It just happens. But so they only initiate those. They don't initiate ones where, you know, it's just some person who lives in Washington. They do have ones that they send over and it's a different code from SSI, where a client has told Social Security that they live in Washington and that they have Medicaid. So Social Security will send over a code that says, hey, we think this client should be on your buy-in file. We're not for sure, but we think. And so our staff get it and they look and they say, oh yeah, this client has Medicare savings program or is on Medicaid. Yep, we agree with that. If we don't agree, then we can send it back and say, nope, this client is not on the program. We're going to decline this action. And so that is an option too, that does come through from CMS.
Right. All right. Well,
I think
Deena,
there's one more in there.
You had a hard stop at 1 o'clock at noon, right?
I didn't, but I mean, I'm
Oh,
okay if
all right.
if you want me
So
to
it would-
answer this other one here.
Yeah, that would be great.
Okay. So if a client gets a no, not eligible for Medicaid, does that Medicaid rejection mean that QMB will automatically be processed? And so if they don't have anything else, or does it mean they have to now do an MSP application? So that would be one probably more for Angie. If they're denied for Medicaid, I guess it would depend. Did they apply for a Medicare savings program also? Did they just apply for Medicaid? They would not automatically, we wouldn't send anything automatically over to DSHS at that point saying, hey, can you screen for MSP? So I'm not really sure how to answer that one.
I will send that question to Angie, and if we
Yeah,
and if we
double
get a
check with her.
response, if we get a response before Monday, when I get, because it's probably honestly going to be Monday before I get all the materials together, because like I said, we have all those letters that you'll have a copy of the letters that people get too as part of the packet for this lunch and learn.
I
Then,
can send you a copy of our no A, no B letter also, if you
oh,
want
that
to
would
give
be
that.
great. Yep, that would be great. Thank you. So I'm just gonna plan to send the material to everyone that is on the attendance list today. And we'll have a link to the recording for this question and answer session and the presentation and those letters. So I'll send that question to Angie, and if we get an answer back, I will include that in the email. Okay. And because I know that's a question that a lot of people have, is if they're rejected for Medicaid, how do they get an MSP application going, right? That's what we're kind of wondering, is what is the process for that? So we'll see if we can get that from Angie and before I send those out. So it might be the end of Monday. I'm going to try to give her until the end of Monday to give me an answer back on that and to get everything together and send it out to you. Do we have any other questions?
This is Van. I think related to that question, that the application for Medicaid, there's a box for you to check. You can check on Medicaid and Medicare saving program at the same time. So that's multiple box in there that you can apply at once. You don't have to apply Medicaid and then go back and apply Medicare saving program. You can apply, if you're on Medicare, you can apply at one time with Medicaid and Medicare saving program in that application.
Yeah, so I'll clarify with her what happens if someone only clicks the Medicaid box. Do they get something about being being eligible for a Medicare savings program? Because I think that's what everyone's kind of wondering, is if they apply only for Medicaid and they're rejected for it. But yeah, that's one of the benefits of checking both of those boxes when we're helping people with those applications, right? That we want to help them apply for Medicaid and for the MSP and push those applications through on Washington Connections. Yeah.
Sorry, Van. Lynn here is my supervisor, so he jumped in to kind of back me up here on anything.
Oh,
so
okay.
Wondering, who is this guy?
Oh, right. Well, I didn't mean to just SHIBA explain you. I was just thinking what we see on our side, because we don't know what the initial application process was usually, right? So
yeah, and yeah, we get confused on that too, because we get them after they apply. So
right.
normally it's like, I don't know, call DSHS. So yeah, it's a good question to know if they didn't check that box, then what do they do?
Right. What does DSHS do?
Yeah.
All right. Are we good, everyone? June Lunch and Learn is going to be community-based resources for seniors. So if you are familiar with any services that you like to refer people to, please feel free to share them with me. We're going to have Carrie Stevens from AltQ coming to tell us about the different programs that aging and long-term care offers. And if you are with any organization that offers services to seniors, or if you know, even if you're local, but you know of other services in other areas that are similar to yours, please feel free to either send me that information, because we're going to try to compile a list that people can use, and or bring that information to share. So that's June. Is we're going to have Carrie. And I think she said about half an hour or so that she would be using, and then we're going to have an open discussion where people can share resources that they've found valuable. Deena, thank you so much for joining us today. We really appreciate it. Deena's going to come back in September, and we're going to talk about Medicaid for people with Medicare. So that's another one that we've had lots of requests for, is how does Medicare change for people before they have Medicare and then once they get on Medicare, right? Because we help so many of those people who are new to Medicare but have Medicaid. So we're going to be able to get some more information on that, and just just Medicaid, how it works once people have Medicare. Okay, that's a wrap. Thank you everyone for joining us today. We're so glad to have you all, and we look forward to seeing you next month.
Thank you.
Thank you.